Greetings of peace. Good afternoon. Welcome to another program from ShuraTV. I'm Dr. Zachariah here from Genesis Medical Center. Today is October 12th, 2021. I'm glad that you can come and join us and help support our programs. I encourage you to discuss with us and interact with us and leave your comments and likes and let us know what you want to hear about in terms of health and future programs that we might have on health. And if you have any questions, any concerns, please don't hesitate to reach out to us. Today's program, we're focusing on joint pain and arthritis, and we're going to discuss some alternative therapies, some approaches, some common approaches and some not so common approaches, and briefly outline what a patient or a client would experience in terms of with a physician in terms of having joint pain and how to go about navigating that so that you get the best treatment possible from your providers and caretakers. It is we're in the fall season currently, and the temperatures are decreasing and getting a little colder, if you can call it that. Here in California, it is getting a little cooler, but it's still sunny and nice. But I know that in other parts of the country, you might be getting ready for snowstorms, and there's a lot of thunderstorms and weather that has been coming about in different parts of the country. So keep yourself safe and warm, and make sure that you do kind of bundle up and wear your layers, and don't expose yourself to the elements unnecessarily, because that too can cause joint pain, right? If you're in the wind, in the cold, a lot of people get exacerbated the pain that they have or they might have in their hips and their shoulders and their knees. These things will get kind of inflamed more in colder environments. So the environment is getting colder, so you need to be aware of that and make sure that you kind of warm up and take out your warmer clothes and sweaters and sweatshirts and wear layers when you're going out, and be ready for anything, any type of weather that can happen that can have a drop in temperature. Last night we were in northern LA County, and the temperature dropped down to like 55, 54 degrees. It was very cold, and we were caught off guard in basic t-shirts and short sleeve shirts, and that was it was very chilly for us, for me and my son and a couple of my nephews. So these things happen, so you have to be aware and alert. Keep a sweater or a jacket, something in your car or in your backpack or something, so that you can always if there is any kind of cold or change fluctuation in temperature like that, you can always be ready for it. Getting to our subject of discussion today. So joint pain. A lot of people suffer from joint pain across the U.S., across the world, but we get a lot of people, especially people who are 55 and older, typically will present with some sort of joint pain, whether it's the shoulder, whether it's the neck, whether it's the lower back, whether it's the knee. These are very, very, very common occurrences and common things that you hear about. Lately, in medical circles, at least, since COVID has happened, the number of surgeries and maintenance and testing, everything has kind of dropped because people have been staying, and even their yearly checkups, there's a big backlog on that. So if you're one of those people that haven't gone to your doctor yet, it'd be important to get at least your yearly checkup to make sure that you're maintaining your health. In terms of joint health, joint pain is something which is usually caused by a few things, right? Number one is an obvious thing, which is trauma. If someone is very active in their life and they're getting, 2 or 3 times a week, they're exercising and you're utilizing your joints, and if you fall or if you hit your knee on something, or you walk the wrong way and you pull something, a lot of people will get joint and muscle pain combination. This happens. This is due to trauma. Also, people that are playing sports on hard surfaces and without appropriate shoes. A lot of our youngsters, they get knee pain and knee trauma, hip pain, hip trauma, and injury because they're not using proper equipment in terms of their playing basketball or running or exercising or whatever they do for activity. They're not utilizing proper equipment or proper tennis shoes. They're running on the wrong type of ground, which is causing a lot of trauma to their body. That's one cause of um, joint pain that's very common in a society where people are exercising and regularly getting activity. Whether some people play racquetball, they get shoulder issues, tennis elbow, golf. When they play golf, they get different wrist issues and back issues because they're twisting and turning. This is all due to some type of trauma. So when this happens, typically what happens is, these people will go to their primary care and complain of the pain, right? You go to your primary care and say, hey, I hit my knee on the gym floor while I was playing basketball. It's very painful. What should I do? The pain, and the doctor will give you some type of maybe non-steroidal anti-inflammatory, something like ibuprofen or naproxen or some type of medication that will decrease the inflammation and also decrease your pain and your sensation of pain. And usually, the doctor will tell you take this as needed, not to exceed 2 weeks. So you take that anti-inflammatory for 2 weeks, and if your pain subsides, great, voila, it's done. But if it doesn't, then you're going to go back to your doctor and say, hey, my pain is still there. What should I do? If it's some type of obvious trauma, then the doctor might order some type of x-ray or some type of imaging to see what's going on that joint, whether it's your shoulder, your hip, your back, your neck, any articulating joint that you could have damaged. So you get the imaging comes back, and they'll tell you, well, you have some sort of damage, or you have, normal wear and tear based on your age, or you might have something where it's in between the two. It could be due to the damage, it could be due to wear and tear, and they don't really know. But you might have some type of scar tissue that has formed in that area, and these are the things that'll come out in terms of your imaging. After that, the doctor could recommend possibly some sort of cortisone steroid injection. Steroid injections very common for joint pain. People get them. Some people do very well with them in terms of their pain is gone for 2 to 5 years and they don't see it again. Other people, they become tolerant and it doesn't really do anything for them. The issue is that these injections, while they're they're good for your pain tolerance and they decrease your pain, they don't really heal the joint, or they don't really take care of that cartilage that's damaged, or that the labrum, or anything, any parts of the joint. It doesn't really take care of it. It just kind of masks the pain. So you need something where you can strengthen the joint, increase mobility, and be comfortable with your joint again. So this is what people seek in terms of patients, right? So the patient goes back, the doctor says, okay, well, let me give you physical therapy. You might get some physical therapy. The best type of physical therapy you can get for joint pain is aqua physical therapy, which is the physical therapy you get in warm water. There are physical therapy companies that have, fortunately, a warm pool at their disposal, and they'll do physical therapy for you in a warm pool, which decreases the stress on the joint and increases the efficacy of the exercise that you're doing, which is great. So some people respond very positively to that type of physical therapy in response to their stiff or injured joints. So this is something that you'll see in the line, and your primary care at this point might say, okay, well, let's have an orthopedic surgeon look at your joint. Let's see what's going on. It gives you the referral. Within 2 to 6 weeks, you get a referral depending on what insurance you have. You go to the orthopedic surgeon. Orthopedic surgeon will look at your images and come up with a diagnosis and a plan. Usually, again, the orthopedic surgeon is not going to just jump into surgery without giving you all the conservative treatments first. So if you're an older person, again, you would get the some type of NSAID, some type of physical therapy, maybe a cortisone shot or two, maybe you get 2-3 rounds of that to see if this will help you and decrease the pain. If not, eventually you'll become a surgical candidate. And when you become a surgical candidate, then, you do the surgery, and we hope that surgery helps you and decreases and gets rid of your pain for good. Not all surgeries are successful, but you have to discuss that with your orthopedic surgeon in terms of the probabilities and the outcomes that he has experienced through his surgical candidates and what has happened when he's done the surgeries. So but you have to be an advocate for yourself and for your health, and discuss this very openly with your doctor, so that they can let you know what the odds are of you getting better. And back surgery versus knee surgery, the success rates are different. Shoulder surgery, versus neck surgery, versus elbow or hip or wrist or carpal tunnel, these types of joints, there's different probabilities and success rates on these surgical outcomes. So you have to look into that and discuss it openly with your doctor, with your orthopedic surgeon. So these are types of aches and pains in the joints that have emanated from possible trauma or possible wear and tear that goes on for years and years. And then, of course, the trauma can be attributed to a blunt trauma or something where it's happened all of a sudden or acutely, or it could be something which is over time, wear and tear. Or if you're someone who's very, you're a runner, you always run every day, a couple of miles, of course, the wear and tear of that will get to your knees, to your ankles, to your hips, and something will give out. You can be nourishing your body and taking, for example, collagen, and taking things like glucosamine, as people do for the joint health. They take the fish oils, they take the things that are good for your cartilage, krill oil. They take all these things, but at the end of the day, the wear and tear and or trauma will get to it, and it'll damage that joint. So you have to be cognizant and aware of that. And as you get older, I would recommend for myself and for others is that you do things which have less impact on your joints. We mentioned aqua therapy in terms of physical therapy. Swimming is a very good sport in terms of joint health. If you can swim 2-3 times a week, it's great for not only your cardiovascular system, but also your joints. It decreases the pressure on the joints, and it exercises all your muscles, and it promotes the movement and fluidity and mobility of your joints. So that's awesome if you can do that. I wouldn't recommend things like basketball and things like that have high impact for your joints, because you have a certain number of years, you have a finite amount of usage on the joints, and as you utilize them more and more, the more wear and tear it gets, the more chance and likelihood of it causing pain and inflammation in the joints. So that's very important to keep in mind. And of course, people are taking, the NSAIDs and these things for joint pain, but after a while, those things will also damage your liver, and they have other side effects. And you don't want to chronically be taking, Advil and ibuprofen and all these other medications for pain. Obviously, what you want to get to is the root of the pain, so that the joint pain subsides and you feel better, and you can have full functional motion of that joint and utilization of it. That's very important. The other type of joint pain that people attribute to most commonly is what's known as rheumatoid arthritis. So rheumatoid arthritis is different because that's due to an autoimmune disease, right? So it's something where the body attacks itself and attacks the joints, and similar to where there's a malfunction of body metabolism in gout, where you get some big joints and they get very burning and painful, and they get a lot of what's known as uric acid formation, and that increases in the body. So those are metabolic problems with the body, and the rheumatoid arthritis is an autoimmune disease, meaning that your body's own immune system is attacking different cells in the joints. So that has a different approach. You have to go see a rheumatologist typically. Ask your primary doctor to get you a rheumatologist. The rheumatologist will run a few tests and see if you have certain antibodies. And if you do, then they put you on a biologic therapy, which is going to be, these medications that have been tested. And what it does is it decreases the inflammatory process in the body so that you don't have those flare-ups when you have rheumatoid arthritis. These things are something which there isn't a known cure for it in terms of Western medicine, and people are on those medications basically for life. And that's what autoimmune, until we discover something else in Western medicine, at least you're on those biologics. And there are anti-inflammatory diets. There's anti-inflammatory lifestyle. Things like alkaline water, lowering your acidity in the body. You want to get rid of things that are highly acidic in the body. So there are things you can do to decrease the symptoms, but in general, usually they'll put you on a biologic. There are functional medicine doctors nowadays that have different approaches to rheumatoid arthritis, where they try to, address the root cause of the immune system, and they try to boost and strengthen the immune system from the foundational block. That's something to look into, because as we learn more things about medicine and our bodies as one system, functional medicine is something to look into, and it has a lot of answers which we haven't been accustomed to in the last 20, 30 years. So that's something that you could look into. But for the most part, you'll be on some type of biological therapy, which is some type of medication, and you'll be taking that regularly in a regimented way, daily, until there's a cure found. Some people also get on steroids to decrease the inflammation and the reaction in the body for autoimmune disease, and steroids are okay to take. Discuss it with your doctor and physician, but they do have side effects, and that's something to kind of see the risk and reward, and measure that and discuss that with your doctor. So those are the rheumatoid and autoimmune joint pain that people get. People usually with that, they can opt for nowadays they get IV antibodies as well, that don't flare up their body as well. They get the different biologics through IV as well. So that's another topic you can discuss with your doctor and see if they have any IV therapies for your autoimmune joint disease. That's something which some doctors are looking into now, and they prescribe as well. So those are basically the breakdown of the different types of autoimmune joint pain and regular joint pain, which is wear and tear and trauma. Nowadays, for example, in Geneva, Switzerland, and in Germany, Frankfurt and Dusseldorf, Germany, they also give, for rheumatoid arthritis, they have IV therapies that they administer with what's known as exosomes and stem cells and rejuvenating cells, which try to boost the immune system and reset it. That's another possibility, but those things are offered outside the U.S. And you can research those. As I said before, Germany is at the forefront, as well as Switzerland. And in South America, there's places like Brazil and Cuba. These places do that for those types of long-term autoimmune diseases. Um, that's basically a summary of the joint pain. If you yourself suffer from joint pain, the best thing you can do is discuss it with your doctor and explain to them exactly so they can decipher whether it is an autoimmune issue or it's a wear and tear issue just from aging or injury. And then once they do that, they can come up with a good treatment plan for you. It's very important to keep that in mind. And, your joints are important. You want to preserve joints as much as you can. And the best way to do that, again, for those of you who are active and exercising daily or every other day, it's important to have the right equipment and don't expose your joints to unnecessary trauma, unnecessary stress. That's the best thing you can do. And if you do that, you'll preserve your joint and your joint health. Um, if you want any further information on these things, you can always comment and ask questions on our on these videos, and we can get you the answers. If you have any specific conditions or you need a referral to a physician that can help you, let us know. We can help you, and we can get you the best type of treatment in terms of your joint pain or your arthritis. It's very important. And as you know, if you're a senior, this is a very common problem. Arthritis among seniors, I think it's like 45 to 50% or more suffer from some sort of arthritis. So it's important that you balance your medications and you balance your life in terms of having that movement and that activity so that your joints don't become stiff and don't become arthritic. Another issue is hydration. Hydration is very important. If you want your joints to be hydrated, you need to be hydrated. A lot of people have hydration issues, and with that, absorption issues where nutrients are not absorbed by certain cells in the body. Also, vitamin D deficiency is another thing that helps, that does not help with joint pain. And then also, low amounts of zinc in the body, low amounts of calcium. These have to be balanced and discussed with your doctor. Usually, he'll do a blood test and check these levels to make sure that you're not malabsorbing things. Like your body's not causing the arthritis in terms of its metabolic issues. So these are things to look at and pay attention to. If you need any further advice or help, let us know. I hope that you've got a little bit of information on joint pain and arthritis, and we're here to help you and inform you and get you more information as you need. And with that, we'd like to sign off and thank you for watching, and we'll see you guys next week.